Thank you, Senator. It's you tend to be a hard act to follow, but I think it's going to be a bigger challenge for me this morning. We appreciate your vision for our community and our region, and we want to build on that vision. And I want to take just 2 seconds to recognize the Central Health Board of Managers that are here. Would you mind standing up real quickly? Because you all got introduced to Clark, but we have our Board Treasurer, Frank Rodriguez, our Board Secretary, Brenda Coleman-Beatty, Manager Katrina Daniel, our Chair, Tom Coopwood, Vice Chair, Rosie Mendoza, our Board Manager, Lynn Hudson, Rebecca Lightsey, and there's, I think Anthony Healy is here somewhere, but I've got glare. So we thank you all for being with us this morning. I think as the Senator laid out a vision and an opportunity for Central Health and in partnership with the community, we want to lay out a vision for healthcare that we believe establishes a way for us to work together. Starting today, we will begin a series of dialogues that are designed to create that shared vision and action agenda that we can all work towards. Our goal is to make Central Texas a model healthy community, and this effort will build upon important and previous efforts that are underway. By joining together in a common vision for the future of Central Texas, we believe that private companies, public entities, nonprofit organizations, all of you who are reflected here in our audience today, by working together, we can make a greater impact on our healthcare infrastructure as well as the overall health of the region. Central Texas faces significant challenges, both in health and healthcare. We must all work together to impact on a very positive and proactive basis our ability to educate our children, to grow a productive workforce, to recruit businesses, and to thrive economically. Healthcare is a pillar of our community's health. It's not just something we seek on a one-time basis or multiple-time basis. Health has to become the bedrock of our community. We have to set our sights on improving our region's health, one person, one family, one company, and one community at a time. The highlights from the white paper, which you're about to hear today, are our starting point for this effort. We want to kick it off with some information that hopefully you had a chance to at least review the executive summary. I believe that you have it at your place. But our consultants who have been assisting with us, Steve Rodini from Health Resources in Action and Margie Ross-Dector of Freedman Healthcare, are going to go over the white paper and present the salient points. We hope that with your leadership across the region, we will develop a collaborative vision and a collaborative action plan to achieve these health and economic outcomes that we want for Central Texas. Margie and Steve, thank you. I appreciate all of you being here today, and I hope that we will continue to see you over the next few months as we lay out a path. Thank you.
Thank you, Trish. I also want to echo the Senator's comments in terms of having such a crowd this time of day. So we really appreciate the enthusiasm and hope this will continue. Again, good morning. My name is Steve Rodini, and I'm with Health Resources in Action. I'm here with my colleague, Margie Ross-Dector, from Freedman Healthcare, and there are a few of our other colleagues out in the wings, Ara Majanian and Rose Swenson. And we're here to present some findings from the white paper on health and healthcare trends and innovations in Central Texas. I'm not sure you're going to find these trends to be a surprise, but what we wanted to do is make sure everyone had kind of the same information. So as we think about the framework, let me just see if I can move this. As we think about the framework about why should we care about health and healthcare, well, the answer is simple and it's also complex. Our future economic growth and quality of life depends on improving the region's health and healthcare system. In this graphic, there are 4 major factors influencing health. So what we wanted to put out here is for you to think about this in the sense that obviously clinical care, which includes access to and quality care, is a very important part that influences health. But as you look at this graphic, and this comes out of the community rankings from the University of Wisconsin, is that social and economic factors such as education, employment, and income are also significant factors. Health behaviors such as tobacco use, diet, and exercise are also significant factors. And the physical environment, including the built environment and environmental quality, are also significant factors. What Margie and I wanted to do today is take you through a few of the key trends we've identified and then also talk about some of the innovations. So in terms of the trends, we wanted to talk a little bit about the workforce and the population demographics changing in the area and growing more diverse. We want to talk about the rise in chronic disease and health disparities and how that's reducing productivity. We want to talk about community infrastructure and resources and how critical they are to health, and in this area, how they're lagging behind growth. We want to talk about access to health insurance and quality, affordable health care and services, and we want to talk about provider shortages. I don't see anyone heading for the door yet. It's not all bad. In this next graphic, the first trend, we wanted to talk just very briefly about the workforce and the population demographics. And as you can see from this, well, first of all, by 2020, the region is expected to grow by 1 million people. That's about 4 times the national average. As we look at the various counties making up the metropolitan area, we see the greatest growth in Williamson County and Hayes County. In this next graphic, the region's population is growing more diverse. Age distribution and race and ethnicity composition is expected to change. Hispanics will comprise 42% of the total population in this area by 2020, up from 32% today. The significance of this graphic, or this statistic, is that Hispanics typically bear a greater burden of preventable and chronic disease, such as diabetes. So if you look at the graphic right under the total, the blue line is looking at the actual and projected growth of diabetes for Hispanics, followed by whites, followed by African Americans, and then other categories. Without appropriate interventions, these trends can and will negatively impact the overall health status of the region and the need for healthcare resources. Healthcare and business sectors need to be prepared for this transformation. In the second trend, the rise in chronic disease and health disparities is reducing productivity and quality of life. Among all the chronic diseases or conditions we looked at, obesity is a significant contributor to increased costs, poor health, and decreased productivity. Approximately 2/3 of Central Texas adults and 1/3 of children are overweight or obese. We've been hearing statistics about the fact that this next generation may not live as long as the current generation if this continues. In 2010, this cost businesses approximately $10 billion in healthcare costs, in productivity, around absenteeism and presenteeism, and workers' compensation or disability. These costs are expected to triple, as seen in this graphic, by 2030. Interestingly enough, though, 80% of all chronic diseases are preventable. Most health conditions, such as heart disease, cancer, and diabetes, impacting our workforce are preventable or controllable. According to Tom Frieden, these are the winnable battles. Tom happens to be the head of the Centers for Disease Control, and this city just received some money through a community transformation grant, and actually Texas just received the largest money from any state, to address the issues of chronic disease. He goes on to say that heart disease, cancer, diabetes, and other long-term problems increase healthcare costs and decrease productivity, affecting the bottom line for businesses. Medical care alone cannot adequately improve the overall health of our community or reduce disparities. A third trend is that the population of Central Texas is growing faster than the infrastructure needed to support a healthy, thriving region. In one of the interviews we did this summer, I see a gentleman right here, Pete. You talked about Pete Perialis from Lone Star Circle of Care. You talked about infrastructure, and you talked about this idea in the interview that when businesses come to an area, they look at power grids, they look at transportation, they look at roads, they look at a variety of things around physical infrastructure. You also talked about investing in a healthy infrastructure, which includes transportation options, access to health and affordable foods, safe green space, education, affordable housing, and the environment. So in just a few of these illustrations, in this one, we look at kind of the issue of transportation. And what we see is that transportation options are not equal or are actually inadequate for residents across the region. So the darkest parts of those graphics represent East Austin and some of the outlying counties where at least 1 in 8, 12% of households has no access to a car. As a result, these residents, as we found in many interviews, not only conducted in the rural counties, but also even in Travis County, residents must rely on family, friends, and public transportation, which can limit getting to and from work, traveling to a grocery store, if there's one in the area, and visiting a doctor. We also found it's hard to eat healthy. This is a trend we see across the country. Some residents have limited access to healthy and affordable food options. On the right-hand side, we have grocery store density. I'm sorry it's not as clear, but the dark blue represents grocery stores. The white represents no grocery stores. Now, some people could argue, well, it's also about population. But what we also found is that specifically only 40% of the zip codes in Caldwell County and only 50% of the zip codes in Bastrop County have a healthy food outlet. What we call this is a food desert. This phenomenon also exists in urban areas all around the country, including Austin. The illustration on the right looks at fast food outlet density. The dark blue represents the density of fast food outlets in the area. In many low-income communities, grocery stores have been replaced by fast food outlets. In some studies, it's anywhere from 4 to 5 fast food outlets per grocery store. The language we're hearing these days is these are food swamps.
Thanks, Steve. Good morning. My name is Margie Rostochter. I'm going to pick up from here on the last two trends that we're talking about up front and what we're seeing here in Central Texas. So Steve talked a little bit about the health aspects. We're here to talk about health and healthcare. And I wanted to drill down a little bit more in the last two trends on really what's impacting our ability to access healthcare services. One of the main issues related to accessing healthcare services is access itself. And how are we going to access high-cost healthcare services? Through insurance. And as you know, America here is based on an employer-based system of offering health insurance. Here in Texas, we have the highest rate of uninsured in the entire country. 25% roughly of all people in Texas do not have health insurance. And again, in being employer-based, we wanted to break down where is it that we are not seeing the increases in healthcare coverage. Large businesses, roughly 100%, anywhere from 90 to 100% of the large businesses are indeed covering their employees. And in fact, employees are saying that that is their most valued benefit that they get offered, and they would take that over increased wages, which is a really interesting study finding. In small businesses is really where in the employed population we're seeing 67% of those who don't have insurance are employed. So it's a little bit of different, it's a fallacy to think about the uninsured as being people who don't work. And here in Texas, and in Central Texas in particular, we're seeing a greater proportion of people who are working who don't have insurance. And really about half of the rate that we're seeing nationwide. Some people estimate that the reason for that is that other states are offering subsidies and other mechanisms to hold down the cost of insurance, and that's enabling them to enroll. 90%, and what's relevant here is 90% of the small businesses here in Central Texas are fewer than 10 people, so that's really the future of our economy here. One of the concerning trends really that's happening is as we're trying to access health insurance and affordability is that costs are going up. And as costs are going up, people are not able to afford to offer their employees health insurance or get it on their own. And not surprising, if people can't afford to access medical care, then they start to see increased illness. They forgo going to the doctor, they forgo critical preventive tests, and they're not exhibiting the kinds of behaviors that with early intervention could be a lot more cost effective. So as a result, the increased illness is leading to increased cost. And this increased cost, of course, is raising it for everybody who has insurance, leading employers and states and governments who are also paying for public employees and the public sector to increase in cost. and leading to a trend of decreasing coverage. So employers, again, faced with increased costs, are finding ways to manage their costs by reducing benefits or dropping coverage altogether. And we call this the decreasing spiral of healthcare services. And I wanted to bring this down to a story that I heard. Steve mentioned that we spoke with many of you in this room and many others. We looked at national research and also locally. And it really was a compelling story. And this was told to me by a physician who worked in one of the local clinics. And he told me a story of a man we'll call him Mr. Sanchez. And he was seen, I guess it took him about 2 months to get an appointment. This man did not have health insurance, although he was working. So he comes into the clinic, and he had diabetes, and so he hadn't filled his medication for a while, and he knew that he needed an additional script. And the doctor came in and just asked him a couple of questions, and he happened to mention to the nurse beside him that his foot was bothering him. He had a blister. The doctor tells me, he said he looked at him, and he said he was triple booked that day, and he doesn't know why, but he asked him to take off the sock for a blister. He takes off the sock. It turns out that this man had a diabetic ulcer that bore straight through his foot, okay? So he actually he unfortunately led to an amputation. He did not have insurance. The medical care provider had to foot the bill, and what happens? The price goes up for us all. The doctor said to me, he said, this happens all the time, and he just wished it didn't have to. So in terms of provider shortages, even if somebody has insurance or they know that they have to go to the doctor, where are they going to go? And this geomap really looks at the number of actual physician offices that are distributed across the 5-county area in Central Texas. What's interesting to note is while healthcare is one of the largest employer sectors, that all 5 counties are designated as medically underserved. And there are lots of details you can read about in the white paper as to why that is. But the bottom line is that we're learning that there's insufficient both primary and specialty care services in the areas that are needed most. To give you an idea of the density that's needed, there are statistics that are measured at the national level. The average per population, so per 100,000 people in the US is 89. So there are 89 primary care physicians per 100,000 people. And in Caldwell County, 26%. 26, okay? Bastrop, 26. This is compared again to the US average of 89, okay? 46 in Caldwell County, 76 in Williamson, and 97 in Travis County. Now, what's interesting about that is it looks like we have a glut of providers in Travis County, and in fact, that's really where the medical hub has been to serve the majority of this population. But what's happening is the population is growing so fast, as Steve mentioned, 4 times the rate at the US, that there's insufficient capacity even within Travis County to accommodate all 5 regions. Plus, we've got people who don't have insurance, and not all medical providers accept all insurance. So to the extent you have uninsured and people on public programs who are not able to visit those doctors, it's insufficient to basically make sure that people have adequate health care, that they're getting the prevention services they need, and are not unnecessarily using services. Senator Watson talked about the physician gap of what's happening over time. Currently is 600 physicians, and it's going to grow to 3,000. This is a big number. Many other communities are growing them from within, and we've really got to find a way to address it. So the way that everything's set up right now, the status quo is discouraging moving ahead, and we really need to find ways to change behavior. How do we encourage people to take more patients, and how do we get patients to seek the care that's needed? There was a study that was done approximately, it outlined $700 billion worth of medical waste, unnecessary care that's delivered in the US. And again, there are many, many studies that look at why is there unnecessary care. I'm not going to go into the details, but just to know locally, one of the numbers I know that many of you in this room have been really trying to crack is 75% of emergency room visits are unnecessary. And why are they unnecessary? Is it because people don't feel like going to see their doctor? In part, it is an access issue. Some people, that's where they need to go. The other piece of it is that there are conditions that people are just not managing. For instance, 15% of the number of the 75 of unnecessary visits are people who had uncontrolled asthma. And the other thing we wanted to make sure that you knew is this is not a problem of the uninsured. These statistics, 75% really is across private and public insurance. Why care about health care? Texas is ranked 49 out of 50 out of the states on almost every indicator except the Healthy Lives rank. Here in Central Texas, we're doing better, and we know we can do better. And that's why we're all here in this room today. So as we talk about the cycle of where we are today, we really want to talk about aligning our systems. How do we go through and make sure that each one of us who represents a piece of the puzzle, a piece of the silo, how are we aligning ourselves to work together to move forward? How do we make that equation 1 + 1 = 3? And how do we do it quickly? Because we have health at stake. So I'm going to walk through, as part of this project, what we did is we really did national research and local research to find out what's working. And we obviously don't have time this morning. We would have had to get you up at 3 o'clock in the morning to even start all the great things that you all are doing. So we're just going to give you some of the highlights of what we saw as themes emerging of what can we do to go forward? How can we focus this debate moving ahead? And how can we all make a difference? And Senator Watson said, you know, why are we all here? This is why we're here. Each one of you is doing a piece of this, and we want to make sure that we share those stories. Okay. So number one, the first tenet is health insurance coverage improves employee health productivity, satisfaction, and retention. There are numbers that prove it. There are savings that emerge from it. This is our economy moving forward. Investing in health makes a difference. Number two, aligning incentives is really going to change behavior. It's going to make the difference between what is nice to do and what we need to do. We really need to encourage us to move forward. Number three, a community with a more robust health infrastructure is critical. We need them to attract an educational, a more educated and entrepreneurial workforce. This is the composition of our future. You know, how are we going to grow? 4 times the national rate, who do we want to emerge here? What kind of a community do we want to live in? Disease prevention and health promotion are less expensive and more effective than treating illness. We know this. We know this. We've known this for a long time. There are many, many ways that we're doing this in multiple settings. We'll talk about that too. And finally, developing multi-sector partnerships, and this is why we're all here, to work together to move forward. Again, health insurance increases productivity. We have the stats. And really what's happening is that small businesses are finding ways to become more affordable to purchase health insurance and to impact employee health by banding together. Just like a co-op, there are many ways that are happening in the private sector and the public sector to encourage those kinds of changes and to invest in worksite wellness. This is the critical thing that we want to do, is that we want to bend the curve. Steve presented the graph of what's happening just with obesity in this country. If you look at this graph going all the way up, what we need to do is to find a way through prevention, through investment in infrastructure, to bend the curve, right? That's what we're all talking about, bending the curve. We're not going to eliminate it, but we can slow the growth, and this is really what we're going to do in terms of prevention. System alignment is what we had talked about. There are market reforms and state reforms. Expanding Medicaid is going to be a critical part of the discussion. I know that's going on locally. And redefining how we deliver services in terms of value, that we're really looking not just at quality at any cost, but quality at what cost? At what point does cost become marginal? The last thing that's really changing, I think, the landscape, that's going to change from a person by person by person impact is what you all have in your pockets, and I'm sure of it. And they're buzzing, and thanks for turning them off and keeping them in your pockets and not fiddling. But this is really what's going to revolutionize the medical care system. Imagine if you had reminders to tell yourself to go take your medicine. Imagine if you had somebody who was charting what it is that you ate that day if you have diabetes, when it's time to adjust your insulin, to record your weight, to basically communicate with other people who are suffering from diabetes, to translate a critical piece of information that you don't have in your own language. This is going to revolutionize not just personal care delivery, but also the way that medical professionals can better deliver their services. They can compare treatments, deliver the right care at the right time, and the right impact. And I'm going to wrap up, I think. And really, the workforce piece of it is really a critical part of how we're going to move forward. Medical education and clinical research, that is a huge opportunity for us to move forward, not just in terms of improving access, bringing providers, bringing scientists to the area, but really moving forward and creating not just what we have now, but building on. Think about how great the Austin area is, the 5-county area. People love living here. People love working here. And this is really our opportunity to continue the growth in the right way, to keep health and healthcare at the forefront of making a difference, on making us really a model community moving forward. And I'm going to kick it back to Steve.
Just two final slides, because I know we're running over. We just wanted to make sure that we also brought in this idea around the return on investment on disease prevention, and kind of the studies that have found that every dollar spent on proven programs and policies results in $5.60 in healthcare savings, physical activity, healthy eating, and smoking. Reducing adult smoking in the US by 1% could prevent 30,000 heart attacks, prevent 16,000 strokes, and save over $1.5 billion. Education is a prevention strategy. We'll hear from one of the panelists later. If you look at this slide real briefly, what we have is that when we look at the percent of adults in Texas diagnosed with diabetes, 14.4% of that group had less than a high school education. 7.1% of that group were college graduates. We need to think about building multi-sector partnerships. What this graph or this diagram really looks at is the community in the middle and all the partners from the various sectors, the traditional and non-traditional partners that need to get together to build and improve the economy. So as we think about moving forward and kind of reversing this cycle, we need to think about systems alignment, we need to think about healthy policies, healthy infrastructure, and prevention and wellness programming so that we can create a region where there's healthy people, healthy economy, and a healthy community. Thank you so much.